All right, everyone, we're moving right along. Almost done. Welcome to Module 10. This is going to be menopause and bone health. So lots of things are going on at this point. We need to have an understanding of these changes by all women. It's really paramount. And there's so much that can be done prior to, during, and after menopause to really minimize the effects that are going on in the body because of this. 80% of women in these perimenopause and menopause time are going to have this musculoskeletal syndrome of menopause. 25% feel debilitated by the symptoms, and 40% at the time say that there is no structural damage that will be found, but they feel that overall achiness and feeling in their bodies. Estrogen directly affects the structure and functions of the bones and the tendons, and with the decline in estrogen from that menopause, women experience just this rapid decrease in their muscle mass, and they're more prone to muscular injuries. So let's talk a little bit about what this may look like. Things that can lead to this causes can be inflammation, decreases of production in the stem cells from the muscles, loss of bone mass and strength, loss of bone density, and that increase in visceral fat, which you've heard us talk about in some of the other lectures. So some of the symptoms you may see are frozen shoulder, joint pains, arthalgias, arthritis, losses of bone density, things that may feel like pins and needles, pelvic organ prolapse, falls, loss of height, all things to be watching for during this musculoskeletal syndrome. You can also see that when we look at this and where different levels of hormones fall, the dark line is going to be your testosterone. The dark line with the circle that's not colored in is going to be your estrogen. And you can see that in puberty, they're on the rise and they slowly decline over life. So again, it's such a hormonal change that's going on that leads to this musculoskeletal syndrome. You can also see with estrogen that there is such a decline in this hormone as we talk about midlife. In our 20s, that red is going to show that estrogen levels, and then it's going to show in the pinks just that kind of deficiency that's happening. And you can see as we age just that rapid decline, which we've been talking to you about through all of these slides. When we look at aging and bone health, it's really important to remain strong, maintain these strong and healthy bones. It's essential for all stages, and the lifetime risk of sustaining some type of osteoporotic fracture after 50 is close to 50% for women and 20% for men. Bones are living tissues. They're constantly changing, remodeling, and reforming. But as we age, these things all start to decline, and hormones are a really big part of it. In terms of osteoporosis, this is a condition where the bones become weak and brittle and most likely to break, more inclined to that. And you can see normal bone is very dense. And as we go through osteopenia, which is the early stages of bone mineral density changing, and then the osteoporosis, and then severe, you can see it becomes more Swiss cheese looking, if you will, in the slides. So some of those signs, they're often silent until an actual break occurs, and a fracture that follows a fall or minor trauma suggests that these bones may be fragile. And then again, significant loss in height, curvature of the spine, those also may indicate osteoporosis. Osteoporosis is more of this condition where bones are fragile, break, and just as a point of information, fractures and broken bones mean the same thing, and both terms will appear during this presentation. So I don't want you to get confused and assume that fractures are different or more serious. With osteoporosis, these fractures occur easily without excessive force or trauma. And in fact, if a fracture occurs after falling from standing height, it suggests that bones are fragile. These fractures are referred to as fragility fractures. And an important point to remember is that if the fractures that cause pain, they change the shape of the spine and the disability associated with osteoporosis. And osteoporosis is the absence of fracture, gives no symptoms. So really important things to consider. Again, our bones change with age over time, and you can see that our genes play in it, our nutrition, and other things of that nature. In terms of bone mineral density and bone scans, they're really useful for looking at significant risk factors. They measure the bone density, and they can be useful for those with a significant risk factor to help them decide if they're at high enough risk that they may need treatment. When we measure bone density in the absence of risk factors, it's usually not a current recommendation. So bone density measurement can be really helpful in determining whether an individual experiencing a fracture has some type of maybe underlying osteoporosis. Though some people where the diagnosis is clear, it's not always necessary. Many people ask whether they need repeat scans to see if the treatment is working, and although repeat scans, they may not be able to provide conclusively whether or not the treatment is working. As you can see, the bone density scans, we have normal, osteopenia, and osteoporosis. Osteoporosis was defined by the World Health Organization in 1994, and it was based on measurements obtained from the bone density scans. When you have a scan, your results are compared with a reference range measurement made against young, healthy women. If your results are 2.5 standard deviations or a statistical measure below this reference measurement, then you're diagnosed as having osteoporosis. If you also have experienced any spinal fractures, you are said to have severe osteoporosis. So these are all really important things to consider. The risk factors for osteoporosis and fractures, of course, age, race, going into early menopause. These are all really important things to consider. Any kind of autoimmune disorders, Parkinson's disease, cardiovascular disease, dementia, if you take steroids, risks of breast cancer and other cancer risks, smokers, alcoholics, low bone mineral density. So again, lots of contributing factors that can lead to bone fractures and osteoporosis. You've heard us say throughout these lectures how important exercise is. Bone loading increases that bone mass. You want exercise, has an important role in keeping our bones really strong. Bone is a living tissue and it increases in loads and forces by growing stronger. Loads or weight-bearing exercises means exercises where the body's weight is pulling on the skeleton. So brisk walking is load-bearing, but swimming is not because the weight of the body is being supported by the water. It's really important for growing skeleton when high-impact exercise such as running and jogging help to build this bone density, especially in the spine and in the hips. All really important things to consider. You've heard us talk a little bit about calcium. Adults need at least 700 milligrams a day, and it's really great if you can get most of it through your sources of food. Milks, yogurts, cheeses, bony fish, green leafy vegetables, things of that nature. In terms of vitamin D, you've heard us talk about this in some of the other lectures. So vitally important. It's almost like a pre-hormone, very essential for healthy bones. It helps to absorb the calcium, and it really does keep muscles strong and prevents falls in order to help with the older population. In terms of treatment for bone loss, menopause hormone replacement therapy, again, is going to be a gold standard if possible for the prevention. It's FDA approved for the prevention. It's not for a treatment, but used as a preventative means. You also may be wanting to talk to your healthcare provider about the oral biphosphonates. And then there are injectable infusions such as Reclast, and then the biologicals like the Prolia. So again, really important things to talk to your provider about. Our key takeaways from this module is just lifestyle choices are really important to help build and maintain strong bones. You want to make sure that the drug treatments that you choose are to reduce the risks of fractures and that you're taking them correctly. Fall assessment and management to reduce the risk of falls, and then making sure healthy lifestyles to maintain strong, healthy bones. So we're moving on to that last module. Hang on, you guys are doing great. Up next, how am I going to talk to my healthcare provider about menopause?